Hello friends, today's topic is Glasgow Coma score. I created a very simple mnemonic for you guys. If you see the video completely, I believe that each and every person will remember this mnemonic. Along with mnemonic, I explained about the Glasgow Coma score also. See, in real-time emergency situation, suppose if any person comes to the casualty with severe trauma, with impaired consciousness, then you have to assess the Glasgow Coma score. That is very important to remember. That's why it's very important to remember. In that emergency situation, most of you will remember, most of you will skip the exact scoring of the Glasgow Coma score. So I created a simple mnemonic for you guys to remember the Glasgow Coma score. Basically, there are three parameters involved in the Glasgow Coma scale. First thing is eye opening. The second one is verbal response. The third thing is motor response. Among three, if you ask me which is the best score parameter to assess, the motor response is the best parameter to assess. Next thing is eye opening. First, I told right there are three parameters: eye opening, verbal response, and motor response. EVM. For eye opening, just remember one channel called ESPN. This is very easy to remember. A channel name ESPN. You are watching a channel ESPN. E stands for spontaneous eye opening. S stands for opening of eyes to the sound or voice. P stands for opening of eyes to the pain. N stands for there is no opening of eyes or no response. It's very easy, right? You have to remember the channel name ESPN. Next thing is my entire mnemonic stands around the channels and all. The second response is first is ESPN channel. The next thing is all channels are closing now. This is the mnemonic for verbal output. O is oriented. Channels. C stands for confused. A stands for inappropriate words. And C stands for incomprehensible words. And N stands for no response. So the maximum score for verbal output is 5 and the minimum score is 1. I forgot to mention in the eye response. The maximum score is 4 and the minimum score is 1 here. Eye opening spontaneously is 4 and no response is 1. Clear, right? The first mnemonic is ESPN. The second mnemonic is all channels are closing now. The third one is the motor response. This is very easy to remember. See, the motor response, the mnemonic is our life with fun, entertainment and news. Clear, right? Everything about the channels and the entertainment. Our life with fun, entertainment, news. O stands for obeys commands. L stands for localization of pain. W stands for withdraws to painful stimulus. F stands for flexion response. E stands for extension response. And N stands for no movements. The flexion response is called as decorticate response and the extension response is called as decerebrate response. You see here two E's are there. Decerebrate is having two E's, corticate is having only one E. So two E's is for extension response. So decerebrate is for extension response. Clear, right? So this I'll tell you in fast way. For eye opening, the mnemonic is ESPN. For verbal output, the mnemonic is all channels are closing now. For motor response, our life with fun, entertainment, news. The minimum score I told. The minimum score for eye opening is 1 and the maximum score is 4. For verbal output, the minimum score is 1 and the maximum score is 5. For motor response, the minimum score is 1 and the maximum score is 6. The total minimum score is 3 and the maximum score is 15. There is no 0 in the Glasgow Coma scale scoring system. If you are not able to test, suppose if anyone is intubated, then you can't check the verbal output. If there is any severe trauma or fracture, then you can't assess the motor response. So if you are not able to test, then you have to write as NT. My entire mnemonic is summarized in the picture. You just remember this picture. The minimum response is 3, maximum is 15. This is for eye opening, this is for verbal response, this is for motor response. NT is not testable. You just remember this, imagine this picture, then you can easily remember my mnemonic. Please subscribe my channel. Don't forget to subscribe. Thank you very much.